Okay, number 9 on the agenda is ordinance number 1243, establishing standards for face coverings in public places with or without a recommendation. That's something that we can talk about to suspend the rules and consider it third read. This, we probably ought to bring, okay, we've got that up. Gotta bring that up and let's go through that and talk about it. This, of course, was brought up because of Governor Little's change to take Idaho back to stage 2. And so this ordinance was something that we had looked at before and wanted to discuss it with the council to get your feelings on whether we should or should not move forward on this. And one of the things I would like to point out is that as we look at this is if you go to the bottom, I don't know if you've got it on your machines there, but the first page, the bottom, of course, says the purpose of this is to enact a regulation to slow the community spread and protect the health, safety, and welfare of individuals living, working, and visiting the city of Rexburg, and allows such an ordinance to become effective. One of the other things, I think, as we look through this and kind of dissect it a little bit, one of the things that, if you go into section 1, face coverings, it says every person shall, when in an indoor or outdoor public place, completely cover their nose and mouth with a cloth or similar face covering when members of the public, and I think that's the thing that we want to try to emphasize, is when members of the public are physically present for otherwise unprotected social interaction. So, we want to point out here that, this, we want this to be a common sense ordinance. If a person is working alone in their office or in a situation where where a mask isn't necessary, we of course don't want to be causing any problems for anyone like that, whether it's outside or inside in a business or things like that. And we want these to be common sense thoughts. And in definitions, it talks about public place shall denote any place to open to members of public without specific invitation. And it talks about business establishments, restaurants, bars, government offices, facilities, and all those kind of things. So those are the the areas in the definitions. And our purpose here is not to go around and look for opportunities to find people or anything like that. The purpose is to still be educating and encouraging people as to what they feel are the best ways to protect people, to protect themselves and others. And that's kind of the gist of this whole thing. We want it to be, or at least my thought is, if we do pass it, it's something that we want to have be there to protect our businesses, to make sure that we don't go further with COVID issues. And we want to try to, our goal, of course, our end goal here, and that's what people have asked me, what is the end goal with whatever we're doing, and that is to keep our businesses open. I think there's been a lot of misinformation that we're looking at trying to close businesses or cause them problems, and it's really just the opposite. Our goal here is to help businesses to stay open and be thriving and, open and available to the public. And so, we're trying to make sure that those are the kind of things that we're considering here. Is there, as we go through this, I don't know if there are more questions that the council has or comments on the items that we've got through here. One of the things that I would like to point out too is in section number 3, duty to enforce. It says, the businesses operate under the principles of private property and may address these conflicts as they see appropriate, provided those measures make a reasonable effort to comply with this requirement. And so, really, all we're asking is the businesses to make a reasonable effort to, to help us out here to be able to get through the issues that we're facing right now with, trying to keep people healthy and trying to keep things moving forward. I think some of the dangers that we face, of course, are, our external forces making decisions for us, which we don't want. We want to take things into our own hands and make sure that we're covered. When I say external forces, I mean decisions that could be made, like maybe any state or federal mandates, if things got bad enough that they felt like they needed to close, or mandate business closings and things like that, which of course we're trying to avoid. If things were bad enough that BYU Idaho and the church education department decided to send all the students home and keep things online, then of course that's an external choice that might be made outside of our control. And so, things like that, we want to try to, I guess, keep within our own control and as a community, and not have those choices made for us. Because one of the things I would point out here in this number 3 also is it says, if businesses will simply put up a sign asking people to wear a mask and maybe have some there available for them, which we have a lot of masks here at the city that we're happy to provide to the businesses free of charge. It says businesses may choose to turn such patrons away without service, as is their constitutional right, provided that they do not discriminate against patrons on the basis of a protected class. So, businesses are free to choose how they react to customers. We're not asking anyone to turn a customer away. We're not asking them to throw somebody out of their business. We realize that businesses have the right to choose how they interact with their customers, and we want to make in here that right is still respected and guaranteed. So we would just ask hotels, Airbnb, and things like that to advise the guests that face coverings are mandatory, which they already are in Madison County. The face mask mandate is really nothing new. It's what we've been existing under for the past several months since the Public Health Agency made that declaration. So basically, this is an effort to kind of clarify things for. Yes, go ahead.
I was wondering how this ordinance is different from
ordinance is
what's already mandated from each level of public health.
How it's different from the mandate we already have?
You did.
It's an effort to clarify for the businesses what their authorities are.
It's Mike. Mike, it's your
Mike,
phone
it's
that's
your-
causing the. There, thank you.
So, Councilmember Walker, if you could mute, he did? Okay, is that better? Okay, thank you.
We will not comply.
So,
We
So
will not
that's-
comply.
what's that?
Somebody yelling, "We will not comply."
Oh, okay.
We will not comply. 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 We will not comply.
We will not comply! We will not comply! We will not
comply. We will not comply. We will not comply.
Can we be civil?
Comply.
We will not comply.
Comply. We will not comply. We will not comply. We will not comply. We will not comply.
Let us in. Let us in. Let
That's-
us in.
that's
Let
really-
us
that's really
in.
different.
Let us in.
We're, so thoughts, I guess, as you've looked through this, what are your thoughts, council members?
Still don't understand what's the difference.
Sorry?
Mr. Mayor,
Yes. Go ahead, Mr. Walker.
the ordinance, our businesses right now, I have nothing against masks. I think, if a person wants to wear a mask, that's fine. I wear them when they're doing businesses. Businesses want to require people to wear a mask. That's their constitutional right. I don't think that our businesses right now are struggling because of the COVID. I don't think we want to make them mandatory that they require someone to come into their place to wear a mask. And if they don't, we're going to penalize them. We're going to charge them a fee, $100 fine, and a $300 fine, and then we're going to take, if they don't comply with their time, we're going to take their business license and shut them down. I think we're overshooting our bounds, and I think that I'm against this for that one reason, and also the mandate. I think we already have a mandate in place, and we shouldn't. People, like I said, people already have a mandate, so we don't need to have another one. But the idea of the businesses having to police their own people. If someone comes into the store to spend money, and you have to tell him that he can't come in because he's not wearing a mask, a person's not going to come back to your store. So our businesses are going to suffer. So I said, I'm against it because we're going to charge them fees, fines, and then we're going to shut them down if they don't comply, and I think that's wrong. So I'm not in favor of this.
Yes. Mr. Wolf.
Mr. Mayor?
Councilmember Walker, I don't think you just listened to what the mayor read. I don't think this ordinance, I have some disagreements with this ordinance, and we'll hit those in a minute, but this one, I think, this particular item, he specifically reads that it is not necessary for them to require a customer to wear a mask. He spelled that out, and he just read it. So.
Yeah, that's correct. The businesses have a right to choose how they
Mute your mic for a minute.
Scroll down further so we can see the rest of the ordinance.
Okay. It states in number 3 here, businesses may choose to turn such patrons away as is their constitutional right. So that means they don't have to turn them away either. That's not the intent of this, is to require businesses to turn customers away. It's to help them have the authority to do that based on, I guess it's kind of making the city the bad guy, if you will. They can say, there's a city ordinance that we have to wear masks if they choose to. They don't have to do that. But that's part of it. Yes, go ahead, Councilmember Flora.
Okay. Sorry, I'm not wearing it right now. But it does say any business violating any provision of this. And if they knowingly and willfully violate any provision of this ordinance a third time, do you see, like, it's almost contradictory there a little bit? Like, they have the opportunity to choose, but then they don't, because if they don't do it, then they can be. So that's I think that's the disconcerting part. I do have a question, though. So my question is this. We have a mandate and that we haven't enforced, and we want to support Eastern Idaho Public Health. Is this to help support them? And if so, why are we just not enforcing theirs? I guess that's my question. I don't understand
Well,
that.
I think the effort here is to have something that does help enforce theirs, something that's got a little bit of consequences to it, if there's
But don't they have
willful
consequences?
noncompliance.
Don't they have consequences to their mandate? It's a law. By the way, we already have the law, right?
Yes, we do. The Eastern Idaho Public Health mandate or health order is the law that we are operating under at this time, yes.
And is there a consequence?
I think there are. Yeah, there are some things that can be. I don't know, we could ask Mr. Zollinger to address that, if you would. The any consequences that could be available under the existing order that we have now from East Idaho Public Health. I mean,
The current order is enforceable under the state law. There is a health provision that allows public health to promulgate rules that have to be enforced. The problem right now, we got an open mic, so you're getting it.
yeah, as we discuss these items, would people please mute their phones so that we can have a discussion here that.
Yes, under the state law, we are allowed their provisions. However, it requires that we use the statute is times exactly it would simply clarify for the residents of Rexburg and the businesses of Rexburg what is expected of them, so that there's not this ambiguous moving target or soft target that has created the confusion up to this point. I don't believe this ordinance as drafted. We took this from the city of Pocatello, the city of Driggs. Driggs has already implemented this, has had it in place for 8 months. They have yet to issue a citation because the businesses have cooperated and have complied because they understand what is expected of them. The thing that you need to understand is it requires the businesses to exercise reasonable efforts. And I think that's what the mayor is trying to explain is, as long as they've put their sign up and said, we don't want you to come in without a mask, we're not requiring them to tackle somebody and stop them. They do have that option of stopping them, but we're not requiring that. What we're requiring is that they demonstrate that they exercised reasonable efforts. Walmart has the same requirement as their stores nationwide. You must exercise reasonable efforts to prevent unmasked people from coming into a Walmart store anywhere in the country right now. That doesn't mean that we've been out there arresting people or citing people who are walking up and down the Walmart aisles without masks on. And we're not ticketing Walmart. Walmart's not firing their managers over that. They're requiring their managers to demonstrate that they exercised reasonable efforts. And, you know, that's a subjective standard, but it's one that we get to decide. It's not decided by the governor. It's not decided by Eastern Idaho Public Health. It's decided by you as an entity and the officers that you've sworn to uphold your rules and regulations. So, this does not add any new restrictions. What it does is clarify the restrictions and how they will be policed locally rather than at a higher governmental level.
Is that helpful? Yes, go ahead, Councilmember Johnson.
So you're saying as long as the businesses put up their sign and have masks available for their patrons, they won't be, it's not like they have to turn away people who don't have masks on.
That's correct.
Or they're going to be cited.
That's correct. We're just asking for additional help, and that help would be basically just what we call a reasonable effort to enforce these requirements, which basically would be post a sign, you know, have some hand sanitizer available and have masks available there for people to put on if they feel like they want to ask them to. If they don't, that's up to them. Yes.
And, oh, sorry.
Oh, sorry, did you have a
I
follow-up?
was just going to say, so I think the part about taking away their license, that's the part that just seems really, really harsh to me.
Yeah.
And I support masks, but I would like it better if it didn't have that
I
part in
agree
it.
with that.
Let me
I've been
address
well
that
at
if I
easy
could,
things.
Mayor.
Yeah.
Yes, go ahead.
That already exists. Anyone who possesses a registered business, a business registration in the city of Rexburg, who fails to follow the rules or regulations of the city of Rexburg, we can take away their ability to do business. This didn't add that. It simply.
I think maybe business owners don't understand that.
Oh.
But I
Yeah,
think that's hard for them to
I think
understand.
that's a definite. Yes, Mr. Wolf.
I think that was the biggest complaint I had today was primarily
Tell the truth, Dollinger.
what was really required. There was a lot of misunderstanding there. But a lot of them took offense to the fact that, oh, someone's going to come into my store, not wear a mask, and I'm going to get my license taken away.
Right.
And I don't think that was the intent. And I understand what Steve just said, and I get that, but I think
Read the
a
ordinance.
little more clear. My standpoint is I'm for mask. I'm against that particular, taking that kind of action. But I think what I would support is, you know, the business employees should wear masks, and they should ask. But if they shouldn't be penalized for that. And I think really it says it there.
Okay.
Yeah.
Or maybe as you read it, it became more clear.
Mind your business! Mind your business! Mind your business!
Okay.
Mind your business!
Well,
Mind your business!
yes,
Mind your business!
Councilmember,
You do yours, I'll do mine.
Councilmember Busby, did you have a comment?
Mr. Mayor, yes, I did have a comment. I concur 100% with what was spoken by Councilmember Walker. I am not in favor of this mandate or this policy right here. There are a couple of things that really disturb me about it is what we're saying right here in open council meeting is not what is being said in the ordinance. You know, it says it's the duty of the businesses to enforce it. It is, I'm just opposed to that. I'm also feeling I feel like we're going back to what we voted on back in July, where it just sprung up. And this mandate is or not mandate, but the ordinance, we barely got this at 5 o'clock yesterday. And it kind of blindsided me, and I think we're playing on some dangerous territory here. I think it's the property owners' rights to do what they want. I wear masks. I wear masks every day at work.
Property owners' rights to do what they want.
I wear masks every day at work, sometimes for 12 hours a day, because my employer has asked me to do that. But I don't know of anybody being fired if they aren't. But that's just my personal opinion here. I think your efforts with United We Stand have been admirable. And I think we can keep doing things. We're going to see some spikes. We have Thanksgiving, we have Christmas. When the college kids come back, we're going to see spikes. But I think that we are leveling things out here a little bit. I know I'm going to be.
It's starting to rise the wave.
Anyways, Mr. Mayor, that's all I have to say. Thank you.
Okay. Thank you. Yes, go ahead, Councilmember Flora.
I have a question about how our hospitals are doing. I've heard that they've started to not be able to do as many elective surgeries. I wondered if that's true. I wondered how their staffing is. Are they able to meet the needs that we currently have? I wondered how our medical and our first responders are doing. I feel like our decision as a community should involve how we're doing as a community and be able to reach out to those people that could give us some information. Can you give us some more information on that?
Sorry, what? Oh, yeah. Yeah, actually, I invited Doug McBride here. Sorry you've had to wait so long. We appreciate your attendance here. And I think that's a question that people always ask. And so if you wouldn't mind coming up to the microphone and taking a minute and just giving us an update on how things are at not only Madison, but other hospitals in the area, so that we've got a sense of where that's.
Sure, Mayor and council members, I just want to let you know being able to take just a minute to talk to you a little bit about. I know this is a very difficult decision and a difficult time that first thing I wanted to let you know that here at the hospital, I want to do this just in a little bit of a roundabout way, but I want to be very direct in what I'm saying here. As far as hospitals in general, when I talk about that, I'm talking about the whole state of Idaho. Basically, the idea is hospitals are hitting significant stressor points. And what I mean by that is areas that the hospitals are trying to deal with and work with. One of those areas are the staffing that was brought up a little bit earlier. When we have or we lose a nurse, say for instance to COVID, that takes out a whole shift of their work. And so the idea of trying to be able to cover shifts and take care of those things sometimes gets very taxing on some of these hospitals.
You didn't answer the question.
Another area that we're dealing with is, obviously there's a lot of resources that go into care for COVID patients and taking care of those individuals, whether it be our equipment that we're dealing with, the number of nurses that have to help or assist or healthcare people. And so it does take a little bit of a taxing on there. Another area is one thing that is a kind of concern right now. The reason why I'm bringing all this up is Rachel, our Chief Executive Officer, is actually the Idaho Hospital Association Chairman. So she basically has those contacts and communications with all the hospitals in Idaho. One of the things that is coming up is obviously our winter months. And we know that the winter months are the times when we start seeing more of our patients, the sick patients who will be coming to the hospital, whether it be the flu or just this is the way that it happens during this time. So that in encompassing on top of that with COVID patients coming to the hospitals, again, will be something that we are concerned about coming into winter months. When we're talking about all of these areas here, again, we see that those hospitals surrounding our community now We're talking about Ermac, we're talking about Idaho Falls Community Hospital. We're even going to Pocatello and Portneuf and all these areas. We're seeing that there was a time not long ago when they were all at capacity for COVID patients. We also saw that encompassed also with their normal patient load was again taxing on their employees. And so I'm only telling you this because this is what's happening around Idaho. Now let me bring this back to home to here in Rexburg. Madison Memorial Hospital, we're doing actually really well. We are extremely fortunate.
You got a big cheer for that.
We are very fortunate to be here in Rexburg. We have a very unique dynamics of patients who are here, of population that is here. That is why I love the simple fact that we have local government here. But it does not take away from the standpoint that this is happening all around us. The thing that we get most concerned about at Madison Memorial is the simple fact that 30 miles away, these hospitals are becoming overtaxed with what's happening there. It would be a very simple and a quick jump for our hospital to be an overload. And so that is what we're concerned about. So this idea of any kind of prevention that we can have is what we're looking for and hoping for. So I'm not pushing you to say to do this, I'm only giving you the information. The hospital is in a situation right now, we're doing okay with what we're having. We generally see anywhere from 2 to 6 patients of COVID. Those patients oftentimes are very sick, and it's a very difficult situation for them. We're able to handle a lot of what comes to our hospital in that respect. When we see some of the hospitals around when we have to do transfers back and forth, say for instance, Salmon was overwhelmed with the patients in their small community. Them being able to transfer to another hospital was very difficult because the hospitals were already full. And so that's causing, again, some problems there. One thing just to kind of keep in mind also, the hospital also has an affiliation agreement with University of Utah, which has been very...
Give us the number!
We know that how University of Utah or Salt Lake or the Utah area has, again, become very, very overwhelmed with this as well. And so they got to a point where they weren't taking any transfers to their hospital for a time. That's very concerning to us because a lot of our patients are actually transferred there. And so again, we have to watch those very closely and make sure that we're taking care of those particular areas. But over encompassing, again, our hospital in our situation right now, we feel good about what's happening here, but that could change overnight. You get one place of business that has COVID that goes rampant in their particular business, and we could be overtaxed overnight within hours. And so again, we just have to be very careful for that. So when we're talking about any kind of prevention we can, these mandates that are in there, if we could just be simply respectful to those and to look at ways that we, as we wear masks, realize this is not necessarily always just for us. It's basically our respect for other people because they're the ones that we are trying to protect from us. And so basically, does that give some information about the hospital, or do you guys have any questions of me or things I could help you with?
Any questions for Mr.
Do you
McBride?
have any actual numbers that you can give us over the past, or from recent to the past 30 days or something?
Of how many COVID patients we've had?
Yeah.
I do not have those with me. I apologize. Yeah, I don't have those.
I know the
But
report I've gotten, it's kind of fluctuated, from 2 at a time to 3 to 4. That they went up to 7
Yes.
last week, I think.
Correct.
And then it went
Exactly.
back down to 2.
I think it's 4 today.
4.
That's what
Yeah,
Rachel
that's right.
said.
You're right.
So yeah, as far as those, it changes, like I say, daily. We see a difference in that constantly. So it does, and that's a good thing because it shows people are recovering fairly well and they're coming in and out of the hospital, which is great. We do have those unfortunate situations where there's much more compromised situations that we're dealing with. So anyway, good questions on there. Does that help some or
Yeah,
give you any insight to
we
that?
appreciate you coming and giving us, yes, is there a question?
Thank you so much. We'd also love to have the opportunity to speak as the people of Rexburg. My name is Giuliano Prieto, and I actually have some questions and some comments that I'd like to have the commission entertain.
I apologize. We are not opening this for a public hearing.
Public doesn't get say. Public doesn't get say when the public.
Hold on, guys. Hold on.
Thank you.
Hold on.
Doug, we appreciate it.
Here's the deal.
Thank you very much. We appreciate that.
Boo, 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 let us in.
So, yes.
The question, she says, has the hospital had problems with normal cases, but aren't able to, take care of those because of the COVID? Not able to.
I think
My
it's fair
question
to-
is have you had to reduce elective surgeries because of COVID cases?
We did. We actually had a time there where we did have to stop our elective surgeries for an amount of time. That, again, was a very difficult thing because those people needing those surgeries and having to push those off oftentimes causes farther problems down the road when they have to be pushed off. So that did come to a point. We actually had that moment where we discussed that again just recently, and we decided to continue with elective surgeries, but just so you know, we got to a point where we had to bring that for discussion again. So yes.
Okay.
Yep. Okay, thank you.
Okay. All right. Thank you, Mr. McBride. We appreciate that. Is any further?
During the summer, you did allow the people to
Yes.
speak, Mr. Mayor.
Councilmember Johnson.
I support what you've presented to us. I just, if we could just make the wording a little bit more clear, that it's not the business's responsibility to police residents. I would think that it's the residents' responsibility to mask up when they enter a public place, and if there was going to be a fine, it should go to the individuals who are not masking, not to the business that they entered. That's my.
I haven't worn a mask once, and I won't.
Okay. Well, thank you for that observation. To be honest with you, I've gone through this. I've marked it up. I've made notes and things, and I've thought about it. I've even prayed about it, and I've always learned that if I'm not feeling very good about something, or if I'm very uneasy about it, I probably shouldn't do it. And that's kind of where I'm at with this as it stands. I don't know how all of you are feeling.
Mr. Mayor,
Yes.
I really feel like there's a big part of our community. When we go through all your letters, and by the way, thank you so much for all of your input and your letters. I really feel like there really is quite a division in our community. We have a half of you really wanting us to mandate it, which it already is mandated, by the way. It is mandated. It is a law. And then we have the other half of you who...
It's not law!
Other half of you that are super against wearing masks. And the part that's really bothersome to me is that we, as a community, on both sides have been very, not everyone, but both sides of this issue have not been very nice. And what makes me feel sad about both sides is, on one side you're saying that we're not caring about our citizens, that we haven't done our part to try to protect the vulnerable. And then the other side that is not very nice is saying that we are overstepping our bounds, and that we are not checking our own motives. And I feel sad because we're doing the best we can. The mayor's out there every night, and we had to literally be escorted into this meeting. How sad. This is not how it should be.
We didn't need escorted. There was no violence. Are you kidding me? That is ridiculous.
I feel like
You chose to get
there's no
escorted. That is bull
respect
crap.
for all the efforts that people are trying to do. And there's a lot of people in this community who are doing their best with this. I think this ordinance, I think that we need to support the mask mandate, the current one, and ask our businesses to help us out, but maybe reduce the threatening a little bit. But I feel like as a community, we need to come together and stop trying to blame. Like, this is enough. Like, let's come together. Let's be kind.
You are the threat.
Don't threaten our freedom.
Some of those comments are exactly what we're talking about. They're really not the way Rexburg should be. We're trying to have a civil discussion here and talk about the pros and cons of this ordinance, and we would really appreciate it if...
You won't let us in. That is not right. Stop with the tyranny.
We've
You need us and walk us out. We're forced to do this.
We've received a lot of public comment and from both sides, and
I don't think we've had a chance to speak, Mr. Mayor. And last time in the summer, you gave us 5 minutes. And if everybody would like to put on the chat that they're okay with me speaking, I would greatly appreciate.
No, this is not a public hearing, and we're not going
name's
to
Giuliano
do that
Prieto.
tonight. So I think what
Definitely
my
would
recommendation would be here is to
Thank you.
Take this ordinance and not move on it tonight. I think I've been settled about a couple of things, and many of you have mentioned that. That is, it kind of came on us quickly and without much time to think about it, and I think I agree with Tisha. I think we need to try to establish some some law and order according to the law that we already have.
Go on public hearing, you fascists. Revert to the Constitution.
And I appreciate our
Stand in the rain.
Chief Turman and
Give us a public
Gary
hearing.
been going around and talking with the businesses and working with them. And I think Councilman Busby said earlier, I think it's made a difference. I feel like when you go to the stores and stuff, there still are some who, there are plenty who are not helping us out, but it seems like there are more.
They don't care about such fascists.
So I'm hoping that maybe we can continue in that trend. And
They don't care about your fascist government.
maybe if we need to
you're
work on
running
it
here.
more and look at bringing it back later, but doing it with more time
Through the council.
to be able to have the
Let the
council, talk about it a little bit more and do that. So
You can keep.
is that something that? Yes.
Mr. Mayor, I'll be very brief. I preferred the mandate that we talked about in July to the one that I saw last night come through at 5:30. I thought there was some language in this that I didn't appreciate, but I support a mask mandate. When we talked about it in July, we had 226 cases. Today, we have 3,590 cases. We should be doing more to flatten the curve. I want our businesses and our people to succeed, and I would like to see some kind of mask mandate. And I got many letters and calls today asking us to please do something. So,
And in
thank
the
you.
end,
I know that there's not the
people who
support
own
for
their
it here tonight.
businesses, they're going to do what they want.
I
People
am
want
a
to find
member
something.
of putting some
civil. Let us in or
into the
we will be
mandate
civil.
that we-
Otherwise, we'll keep annoying you.
Okay.
And annoying
Thank
to
you,
the death what you
Councilmember
want
Mann. I
right
appreciate
now.
those comments.
Because,
Yes,
you're
Councilmember
fascist
Johnson.
I also have to say
behind
that
locked
I think
doors
I
with
can
your
speak for
officers
all of
out
us that
front.
this was
You don't want freedom.
incredibly stressful.
Look, let
24 hours. And so
Yeah,
I'm
I
just trying to
agree.
figure out what happened. Like,
Well, listen.
all of this, and now we're just dropping it.
Your fines. Nobody's gonna pay them.
Again, we're gonna go through all this again, so I feel utter frustration of what is happening here.
People have to govern
I
themselves.
don't understand, like, we had a threat against us. I'm not doing this again, so we pass it tonight or we're done. I'm not doing this again.
Public hearings are
I'm very
public.
frustrated about this.
Seriously? There was no threats.
All right.
It's perfectly safe for you to walk.
Well, I don't believe there is support for this,
people for not wearing a mask.
Mr. Mayor?
printed. Yes, go
I'm
ahead.
just wondering, couldn't we just make a simple thing, a simple request to follow the current mandate and ask the businesses to please help us? Please help us to do their best to not enforce it, but to like show their support for it. And couldn't we pass that? Or does that have to be written up like before?
I think there's something that would probably need to be written up.
Needs to be written up.
Yeah.
Encouraging last fake
Masks.
Yeah.
They will wear them to get what they want.
Oh, yeah. Yeah. Well, we will work hard to,
You had to be escorted. You did not need to be escorted. That is ridiculous.
That's what,
I have it enough, dude. Just
and Gary
you
have
shut
been
up.
doing, and I think
Flags.
we can.
You're acting as a threat to this civil party, okay? We're trying to get through this with the city of Rexburg, and you're disrupting it.
Decent
Just
response.
let them do it.
Yeah, so I think we can try to do more of that.